I was diagnosed at 19 weeks, 2 days. That's when the doctor did a scan and said, "You have twin-to-twin transfusion syndrome. I need to refer you to a clinic in Houston."
My name is Karen Moise, and I am the clinical nurse coordinator for Children's Memorial Hermann Hospital. When patients are diagnosed with twin-to-twin transfusion syndrome, it's very concerning and very worrying. The problem occurs when there's an unequal sharing and one baby gets too much blood and the other one doesn't get enough.
I had just seen my regular OB the week before, and she had done an ultrasound scan and checked heart rates and fluid levels, and everything was 100% fine. So in 1 week, they went from being fine to the fluids being off. I think I was just kind of shocked and terrified.
When you read about TTS, the statistics are not very good. And if you do nothing, there's a 90% fatality rate.
I talked on the phone with Karen before we made the appointment, and she was very confident in her husband and confident in their center and the fact that they do this and they save babies.
We actually watched Alicia for a few weeks. She and Greg traveled back and forth from Austin a few times before we, said, okay, now the twin-to-twin is changing the plan. And do you want us to go ahead and proceed with the surgery?
At that point, we began to talk about the laser treatment to separate the baby's blood vessels, if you would, so they each had their own piece of placenta. And with that treatment, we can save 70% of babies, whereas 90% would have lost the whole pregnancy without the treatment.
One of the things that I feared most, I think, was losing one. And, raising a twin, knowing that there was a twin up in heaven. And that was the part that was scary to me. Obviously, I was terrified to lose both of them, but the prospect of losing one and then carrying that baby to term, and then delivering both of them was actually pretty horrifying to me.
Years ago, when I would take care of these patients, we would simply take the extra fluid out. And it didn't work. The fluid came right back. And they inevitably delivered prematurely and lost their babies. This is definitive. You can go in with the laser, separate the vessels, and the condition reverses. It's not perfect, but it's the best we have, and it's made a big difference in these patients' pregnancies.
I remember when Dr. Moise came out after the surgery, he had spent several minutes with me telling me how everything went well. He had done all he could do. Literally, the rest was up to God.
When we finish that surgery, we're still holding our breath until the day that they deliver. We pull the ultrasound machine into the room, and everyone's got their eyes fixed on, not only on us, but on the ultrasound screen.
Every parent knows that sound of the heartbeat on the ultrasound machine, and when you hear one, and then you just hold your breath until they scan to the other side, and those were the best words I had heard. There are 2 hearts beating.
The people at Children's Memorial Hermann Hospital are truly family. It's when you walk into the building, you feel that the employees are passionate about their job, about caring for patients. And when I came here, that was what I wanted to be a part of.
But Karen has this amazing motherly attitude towards the patient, and she really, I think, has been the success of our center. We're technically good surgeons, but she's the one that brings this patient here, makes them comfortable, talks to them on the phone before they ever get to us, educates them about their disease.
We walk into a room and a couple sees us and they see that we're married. They see that, wow, a family's taking care of our family. They're not just coming to an office, to a medical office, a cold, sterile environment. They really do feel like they're coming into our home.
They took a personal interest. In fact, Karen checked in on Alicia all the time and really made her feel at peace and at comfort. They receive all the kudos that I could ever give them in the world for their patient care.
Our best case scenario is to take home 2 healthy babies.
The fact that he could save my boys through this tiny Band-Aid incision is miraculous. And there's a banner on the twin-to-twin that says, my TTS preemies are stronger than your statistics. And I like that.